Friends, today we will discuss about a very common and interesting topic which is known as GERD. It's called as Gastroesophageal Reflux Disease. Now friends, many of us are suffering from GERD on a day-to-day basis. It is a disease in which whatever we have consumed, whether it be solids or liquids, the acid that is produced in our stomach, all of that comes up into the chest. That is why we have a sensation of heartburn, burning in the area of our chest. Sometimes it is painful also. Some people get a feeling of ghabrahat, that is a tightness in the chest. Some people have dry cough since weeks and months altogether. So all these symptoms are attributed to GERD. Now today we will discuss a bit in detail as to what GERD really is. So just to make you understand, this is a schematic in which we can see that from our mouth we have the food pipe which is known as the esophagus. As we come down, here there is a junction of the food pipe and the stomach. Therein lies a valve which is known as lower esophageal sphincter. It is generally closed and only opens up when we consume some food. And lower down, then the small intestine and large intestine, all these things come. This is a very beautiful animation in which we can see that as we consume food, now this food bolus slowly passes along the food pipe. The food pipe muscles push it downwards and the lower esophageal sphincter opens up for a few seconds. The food passes inside and it closes off. Now the process of digestion occurs in the stomach. What happens is, in some patients this wall does not close properly, so the acid starts coming up. This causes swelling and ulceration, erosions over the esophagus, which actually is not made to sustain this acid. Only the stomach wall is made by God in a way that it can tolerate the low pH of the acid. So these patients get all these sort of symptoms. So GERD patients need to understand, to avoid such symptoms, what they need to do is change their lifestyle. They have to eat more frequently but in less volume. If you eat more voluminous food or eat a lot of food, what happens is the stomach pressure increases because of the large amount of food that is consumed. Because the pressure of the stomach increases, it propels the food even up, and then we have reflux till here, or some people also have vomiting. The other thing that we need to understand is, after consuming food, whether it be lunch or dinner, you should not immediately lie down. You should walk for a while or do a sitting posture known as Vajrasana. If you do all these things, the food gets time to settle down and the digestion starts and the food is pushed forward into the small intestine. The third thing that you need to understand is consume a lot of water daily. So the simple funda is, if you consume a lot of water, then the stomach pH will itself increase, the acidity will go down, and whatever refluxing part is present will not cause as much damage to your esophagus as it normally does. The treatment for GERD is also similar, that we give some antacids, some PPIs which decrease the production of acid in the stomach, so that because of the more alkaline content, we do not get as much symptoms of reflux as we get normally. To permanently cure reflux disease, there are a lot of surgeries available. Patients who do not have any lasting treatment because of the medicines or the tablets available do benefit from the surgery, but it has to be very selectively done in patients who will definitely show some improvement, or else the surgery will cause more harm than good. So this is a bit of detail about GERD. I hope this solves a lot of confusions in your mind as to what this reflux disease actually means. Thank you.